Inhalation Lab Director here at Bellarmine in the School of Nursing. And today I'm going to introduce you to our high fidelity simulator, iStan from Medi. You'll learn about how to obtain physical assessment findings on him and the kind of activities that you'll be doing when you come through for your courses. When you come over to our high fidelity simulator, you'll be completing scenarios where you'll be providing care for a patient. One of the most important things to remember is that we treat the scenario as a real situation, just as you would in clinical. Your patient is a real patient. We're going to go back to our basics and always remember our safety, patient identification, and communication, just as you would with a real patient. Okay, this is our high fidelity simulator, iStan. As you can see, he is blinking. That is a difference in between the high fidelity and the mid fidelity simulators. His eyes will open and shut. They can shut when he's sleeping or if he becomes unresponsive. As you can see, he has pupils. His pupils can change sizes, so you can assess for the size of the pupils. However, they do not react to light. So you will go through the motions of assessing for that, and you will be given that information if you need it. Also, on his face, you can see there's some tiny little holes up towards the forehead and then next to the eyes. That allows for secretions, tearing, sweating, or diaphoresis. And as you can see, there is some fluid coming out now, and so he is becoming very diaphoretic. You'll be watching for that as you assess your patient. You are also able to take a full set of vital signs on the high fidelity simulator, iStan. You may take blood pressure, pulse, respirations, and also obtain a pulse oximetry reading. To get the blood pressure, you may take a manual blood pressure. As you can see, he has a cuff already placed on his arm. This is a specially adapted cuff for taking blood pressure on him, so it will already be in place when you begin caring for your patient. When you palpate the brachial artery in the antecubital space right here, you're actually going to place your stethoscope a little bit above that. You can see where this pink square is to locate that location. So that's where you will place your stethoscope when you are inflating the cuff to auscultate the blood pressure. You can also palpate the radial pulse to obtain your pulse reading, okay, for 30 seconds or 1 full minute. There is a pulse oximetry probe that can be placed on any finger. Okay, as you take it off, the reading will not show, and when you put it back on, the reading will come up on the monitor. You may also count the respirations one of two ways. You may auscultate those with your stethoscope by listening to the breath sounds over the chest area. Listening for inhalation and exhalation. One of the other differences in high fidelity simulators is that their chest is able to rise and fall. So you can also count your respirations by watching the rise and fall of the chest. Place your hand on to feel that, or just by looking. You are also able to auscultate many sounds throughout the body on the high fidelity simulator. You can listen to lung sounds, heart sounds, and the abdomen. The lung sounds you can listen to anterior on the front side of the patient or posterior on the back side of the patient. He is very heavy, so the best way to listen to the posterior side is to have some help and roll your patient to the side. It will be very difficult for you to actually sit him up in the bed by yourself. So rolling to the side will be the best way to use proper body mechanics for him here. When you're assessing your patient while providing care, you want to listen to all the areas of the lungs. The lung sounds can be different in different areas. So you'll place your stethoscope on the patient, listening for the inhalation and exhalation. And then you can also turn the patient on his side and then listen to the back. As you can see, there are a few metal pieces on the anterior side of the patient's chest. Those will be for more advanced scenarios when you're further along in the curriculum, for things like heart monitoring and defibrillation or shocking during cardiac arrest. You may also listen to the heart sounds in all 5 cardiac areas. Once again, by placing your stethoscope on the chest, you can listen for the different heart sounds. And count the heart rate, the apical heart rate. You can do it by listening there. In addition to the lung and the heart sounds, you can also listen to the abdomen or the bowel sounds. You may listen in all 4 quadrants or all 4 areas of the abdomen, and you can hear bowel sounds in each of those areas if they are present. The high fidelity simulator patient does have a generator that keeps him working inside of his abdomen area. So every few minutes you might hear a machine kick on. If you do hear that, if you wait just a couple of seconds, that will go off, and that's the best time to auscultate for assessment findings on your patient. You won't be hearing any background noise if you wait for that to stop cycling. Our iStan high fidelity simulator is also able to speak to you. There are pre-programmed sounds and phrases he can say. There is also a wireless microphone where somebody can play the patient, and so you'll be able to have an actual conversation. So don't forget about questioning your patient and conversing and communicating with your patient while you're providing care. A few of the sounds that he can make are things like coughing, crying, and responding to pain. You're also able to assess all of the peripheral pulses on the extremities. There's a brachial pulse located in the antecubital space. There is a radial pulse located inside the wrist. As you can see, our patient's armband is here, so that's how you will identify your patient by their name, their birth date, and their medical record number. You may also assess for capillary refill on the thumbs of the upper extremities. You apply pressure to the nail bed, and you'll see a light, and that will give you the capillary refill for your patient. You can also assess the lower extremities on the high fidelity simulator. His legs, looking at the skin. You can assess for the peripheral pulses on the dorsalis pedis on the top of the foot, and the posterior tibial on the inside of the ankle. You may also assess for capillary refill on the big toe only, so applying pressure and once again looking for the light. And then once you're finished assessing your patient, make sure that you're always covering them back up. There's also a urine output for your patient here in the sim lab, so you are able to assess the amount of urine output if your patient has a catheter draining their bladder. There are a few things that you are not able to assess for on the high fidelity simulator. I mentioned before you cannot assess pupil reaction with light, so you will go through the motions of that and we'll give you the information. Some other things that you may not be able to find on the simulator would be the overall skin color and overall skin temperature. You still need to assess for those things as you provide care for your patient, and we will give you that information in some way while you're here. In more advanced scenarios, you may have a monitor for your patient that will show the heart rate in white. You can see that's 71 right now. It will also show the pulse oximetry reading, or the SpO2. That's 98% in the purple. It can also show a non-invasive blood pressure. You can see there in the green, 116/51. You're also able to administer oxygen or use suction on your patient. As you can see above the patient bed, that is on the wall. There is not actual gas or oxygen that comes out of there. It is just simulated. So when you apply that to your patient, you set it up in the usual way, and just let us know how many liters of oxygen you would like to put your patient on, or how much suction you're using for your patient. Once again, when you're here, always remember your basics: safety, patient identification, and communication with your patient. Okay? Checking if your patient needs anything before you leave. Making sure the bed's in the lowest position and all the side rails are up. Right next to your patient's bed, there is an area to prepare medications for medication administration. Your patient will have a drawer in the cart that has all their medications they will need, and all the supplies that you need to prepare your medications will be available here for you. There is also gloves right above here, making sure you're wearing the appropriate protective equipment when caring for your patient. Hand gel to make sure you perform your hand hygiene before any task or entering your patient's room. We have sharps containers right here, so you can properly dispose of your needles if you're preparing injections or anything that requires a needle. Right next to the medication cart, there's also a supply area. Over here you will find anything that you will need to care for your patient during the time you're here in the simulation lab. Dressing supplies, linens, personal care items, or anything like that that you would need, we'll have out and ready for you when you're here. There is also a nurse's station area where you will find resources you can use for your patient, reference materials you may need to look up information. From this area you can place phone calls if you would need to contact a healthcare provider or another department regarding the care of your patient. In this area we also have computers on wheels where you will be documenting your care in an electronic record for your patient. You may document your medication administration as well as your assessment findings and care for your patient here. And we will show you more about how to do this as you're here in the simulation lab. So you've learned a little bit today about how to assess the high fidelity simulator and where to find the needed supplies and equipment that you'll need while you're here in the simulation lab. Remember that each time you come, we'll remind you where you can find things, and if you have difficulties assessing the patient or finding what you need to provide care, we will assist you with that while you're here. And once again, I want to remind you to treat the situation just as you would your clinical experiences, and treat the patient as a real patient. That is how you're going to get the most out of your learning experience here in the sim lab.